All right, it is 11:30 on the dot, and I see folks are mostly in from the waiting room, so I'm going to get us started. Thank you for joining us for the second annual Connecticut Affordable Housing Conference and for making it into this session. I know lots of folks have had some technical difficulties this morning, so thank you. If you were one of those folks, thank you for your patience. If I was the one troubleshooting behind the scenes, thank you for your graciousness and welcome. So I'm Chelsea Ross. I'm the Deputy Director of the Partnership for Strong Communities, and lots of you have interacted with me over email for the last couple of weeks. I also have Kaylee Pratt, Senior Policy Analyst, here on the session with me today to help me out. This year, Partnership for Strong Communities is hosting 3 days of sessions featuring local, state, and national experts leading conversations that explore challenges, share best practices, and coalesce us around critical next steps to address key affordable housing issues in our state. Join the conversation at hashtag CAHC 2021 on Twitter. Follow us at PSC Housing if you aren't already. And you are in the session titled, Does the Road to Integration Run Through Your Town? And we have some of those experts here with us today. And before I turn it over to them, we'd like to thank our leading sponsors, the Connecticut Housing Finance Authority and the Melville Charitable Trust. Their deep support has allowed the conference to happen again this year. Thank you to our collaborating sponsors, the Connecticut Department of Housing, Webster Bank, and Rockport Mortgage. We have an armful of supporting sponsors that have helped make this conference happen, including Beacon Communities, Corporation for Supportive Housing, Elm City Communities, Capital for Change, Fairfield County Community Foundation, Federal Home Loan Bank of Boston, JHM Group, LISC, National Equity Fund, and Trinity Financial. Last but not least, thank you to our session sponsors, LISC and National Equity Fund, for making this session happen. A few housekeeping items before I share it or before I turn it over to our presenters. This session is being recorded and we'll make all recordings available to conference attendees as soon as possible. For all sessions today, they may be broadcast on CTN. All of you have entered muted. Please remain on mute unless the speaker has asked you to unmute. If you have a technology issue, please select the chat icon in the Zoom control panel and send the chat to Chelsea Ross, PSC Zoom meetings, and I will do my best to assist you. And your speakers today will let you know how they would like content questions to be submitted. So with that, I will now turn it over to Erin Kemple to get us started. Erin.
Thank you, Chelsea, and thank you everyone for being here. I'm seeing that there are a lot of people in this event today, and I'm just thrilled to see that there are so many people who are interested in hearing about whether or not the road to integration runs through your town. We are going to, I hope everyone can see my screen. It is, today you will be hearing from both the Connecticut Fair Housing Center and CT Data. And with no further ado, I will turn it over to Michelle and from CT Data, and then we will introduce the people from Connecticut Fair Housing Center. Sorry.
Great, thank you, Erin. I'm Michelle Riordan-Nold. I'm the Executive Director of the Connecticut Data Collaborative and really excited to be here presenting today. So thank you. This is a mission of CT Data. For those of you who don't know, we're striving for informed decision-making across Connecticut, empowering an ecosystem of data users by democratizing access to public data and building data literacy.
And what you're seeing right now is the mission of the Connecticut Fair Housing Center. We're a statewide nonprofit working to ensure that all Connecticut residents have equal access to housing opportunities. I should actually say equitable access, because we all know that equal access doesn't actually provide access for some people. Because housing discrimination disproportionately affects people with low incomes, the center focuses on the intersection of poverty and housing discrimination, while also assisting homeowners who have lost or have been hardest hit by the nation's ongoing foreclosure crisis. 13 years after it started, we're still seeing the effects of it here in Connecticut. I'm Erin Kemple. I'm the Executive Director of the Connecticut Fair Housing Center, and I'm joined by my colleague, Fionnuala Darby-Hudgens. If you could introduce yourself.
Good morning. Thank you, Erin. I'm Fionnuala Darby-Hudgens, the Director of Operations for the Connecticut Fair Housing Center, and really happy to be here and grateful for this opportunity. So thank you to the partnership.
And we do have a PowerPoint. We will be going back and forth between all three of us because we all have different pieces that we will be presenting. If you have questions or if you have comments, please put them in the chat. We will also take turns responding to the issues in the chat and asking the questions. So let's get down to it. One of the things that we're going to be talking about today is how we promote integration. So right now, the center is working on a document that actually tries to answer this question. It's called the Analysis of Impediments to Fair Housing Choice. And for many of you, you may have seen the document that was put out in 2015. We're updating that, we're using new numbers, and we're looking at new issues because, of course, new issues come up all the time. So in that document, and really all communities that are receiving federal money are supposed to begin by exploring, for instance, what's the intention of the fair housing laws. So the intent is not only to stop discrimination, but also to promote integration. And in order to really look at that, you have to look at the legacy of housing discrimination policy and other discriminatory policies that have contributed towards segregation. We have looked at who lives in Connecticut and where they live, but mostly what we're looking at is why people live the way where they do, and are there barriers to integration. And when we get to the end of this session, we're going to be asking you to give us your feedback on how to overcome barriers to integration here in Connecticut. So I'm now going to ask Finn to talk about one of her favorite topics, which is the history of fair housing and how we got here today.
Excellent. So in a couple of slides, I'll give greater detail about how we arrived at very segregated Connecticut and how a legacy of historic land use and housing policies have gotten us there. But where I want to start and really level set is what Erin touched on in the last slide. And so the Fair Housing Act was passed 7 days after the assassination of Martin Luther King Jr. It was one of the most contentious pieces of legislation in Congress, and I think to date is still one of the most filibustered pieces of legislation in Congress. And the Fair Housing Act was passed to do two things very specifically. The first was to prohibit discrimination across all housing transactions, right? So everything that you and I, even as individuals who live in homes, do every day, whether we sign leases or take on new mortgages, right? The Fair Housing Act makes discrimination in those transactions against the law. But the other thing that the Fair Housing Act is supposed to do, or is intended to do, is to promote policies within jurisdictions that would promote integration. And across the country, fair housing organizations like the Connecticut Fair Housing Center have done a pretty good job at the first half of that. We represent defendants or victims of housing discrimination annually, and our office alone serves about 1,500 people a year. However, as you'll learn as we go through these slides and examine new data about who lives where in Connecticut, we as fair housing advocates and as organizations have not done a great job at the second half of the mission of the Fair Housing Center. And so really what that question is, or how that leads forward, is sort of asking that question that I'm going to turn over to Erin and suggest and ask, what does it mean to fully promote integration?
So any jurisdiction, and we're talking here municipalities, the state of Connecticut, housing authorities, subsidized housing providers that might receive subsidies from the federal government, any jurisdiction receiving federal funding must affirmatively further fair housing. So what you see on the left is the list of the types of federal funding or federal assistance that trigger the obligation to affirmatively further fair housing. But I think what's most important is it is not just making housing discrimination illegal. It has to really look at the historic legacy of decisions and policies that promoted segregation, and requires jurisdictions to have data-driven plans to reduce segregation and the negative impacts of discriminatory land use and housing policy. So we're looking at that right now. That's what we'll be looking at today, and giving you more information on.
And so, as Erin said, to affirmatively further fair housing, we're required within any sort of governing entity to really look and undermine a legacy of discriminatory policies. So I'm going to spend about 5 minutes here walking through about 100 years of history, and it's very quick, and I apologize, but I'm happy to send out pieces of this presentation to share, and I hope that you'll continue to ask questions in the chat. So around most northeastern cities were developed around the Industrial Revolution, early 1900s, and our first real push to develop housing was privatized. It was privatized by the factories that developed those cities, right? And so as we have in Hartford, and I hope many of you are Hartford oriented, you see some of the first housing or push for large amounts of housing to be developed around the Colt factory. And that housing is still in existence today. And so that actually brings a moral, right, or a value that is still valued today, that workers needed housing that was affordable and close to their jobs, right? And that has not ended. Right, that's still something we seek today. And so the Colt factory saw an opportunity, like all factories across the Northeast, to build workforce housing. And unfortunately, while they provided this affordable housing close to jobs, they only provided it to white workers. BIPOC workers or people of color were excluded from workforce housing. And so we immediately begin to see a divide of access to affordable housing close to where they work. This practice happens throughout the 1920s. And really we begin to see sort of the segregation in cities where folks of color are required to live in very small spaces and they're not able to integrate cities. After that practice, we now have sort of the onset of the Great Depression. And this is the first time the federal government decides to dive into housing and housing infrastructure. And the reason really was to save all that early 1900s, 1920s development from foreclosure as a result of the Great Depression. And so they created the HOLC, which was given charged basically by the federal government to assess the risk of underwriting mortgages and saving homes from foreclosure. And what the HOLC did was, because they had no idea what they were doing. Now, remember, this was the first time the federal government sort of got into this lending and buying and subsidizing mortgages and getting into the housing market in general, was that they didn't know how to do it, right? They did not know or understand how to protect their investments and how to leverage assets. And they had to determine sort of the risk of lending, right? Or patterns of what would be considered quality lending or not. And the way that they did this was they sent to 267 municipalities across the nation, they sent out field agents to grade neighborhoods to assess risk. And the way that they did this was they determined risk mostly by who lived there, and the race and national origin of the folks who lived there, and not by the infrastructure or the quality of housing in those neighborhoods. Neighborhoods where people of color or Jewish people lived were downgraded and were considered to be less or a much higher risk of investment or mortgage underwriting insurance. And so this practice, while did not last too long at a federal government, this practice continued for a very long time. In private institutions, and these maps were used. I think there's some evidence that they were used throughout the 1980s. So again, we see the exclusion of people of color from housing opportunity. This happened throughout the 1950s when the GI Bill was subsidized mortgages for returning soldiers, but only subsidized them for white soldiers. And then again, when we see a large federal investment in infrastructure and development throughout the 1960s and 70s in highway development and urban renewal, we see that when there are spaces built for folks who can access home ownership, they are invested in, and when there's spaces that need revitalization for predominantly people of color, those neighborhoods are torn down. And we see that throughout urban renewal projects throughout Connecticut. And finally, we see a continued disinvestment in the access of affordable housing and an increased investment in luxury housing, and substantial displacement from subsidized housing in Connecticut. And that all leads to what Michelle is now going to begin to describe, because where we invest and build housing determines who is able to live where.
Thanks, Finn. Yeah, so as Finn mentioned, that all plays into who lives in Connecticut. And as you can see, the demographics, the racial and ethnic demographics have changed over time from 2000 to 2020. However, we still remain largely a white, non-Hispanic majority state. We've also had really slow growth in general in the state, with only growth in the last decade of 0.9%. But you can see the BIPOC population has increased from 22.5% in 2000 to 36.8% in 2020. So what does this also mean in terms of the age of our residents? We're slow growth, right? 0.9% overall population growth, but we're also we also have an aging population. So about 14% in 2010 were over the age of 65, and that's projected to be about 16% in 2020 and continue to grow as in the next couple of decades. What we did see in the most recently released 2020 redistricting data that came out in August was that our under 18 population went from about 817,000 in 2010 to 737,000 in 2020. So that's about a 10% decrease in the under 18 population. And what's interesting is we took a look at, with the 2020 redistricting data, we took a look at the population and the relationship to housing. And what we did see was, when we looked at a Pearson correlation, a moderate correlation between increase in housing or decrease in housing and increase or decreases in population. And what really stands out is what happened in Stamford. Stamford was our fastest growing city in the state, with a 10% increase in population, and it also had the highest increase in housing, 13% increase. So there does, great. Okay, go ahead, Finn.
Did you want to finish your sentence there, Michelle?
Oh, sorry.
That's okay. Yeah, you can see the moderate correlation when you look, straight line through the dots. But that's it. Go ahead.
That's quite all right. Erin was just very eager to get to the next slide. We're super excited to have some audience participation at the end. So we want to get through this data so that everybody is able to have an opportunity to share their own solutions to our problem of segregation in Connecticut. And one of the things that also really very correlates with who lives in Connecticut is income and wealth disparity in Connecticut. So income and wealth falls really closely along racial and ethnic lines in Connecticut, and as of 2019, Connecticut had the second greatest income disparity in the country, when specifically looking at an income gap between white and Black and African American families. Additionally, we see lower earnings for single parent female-headed households and for women and for people with disabilities across Connecticut, in addition to the income and wealth disparities falling along race lines. And so why this is so important to recognize is that because income and wealth falls along so closely and correlates so closely to racial lines in Connecticut, it deeply impacts where BIPOC people are able to afford to live. And so Connecticut is in the top most 15 segregated states in the country, and it is more segregated than several southern states. We measured this in a couple of different ways, and Michelle and I are going to talk about that. But one of the most startling and just really, I call it generic statistics, is that almost 73% of people who identify as any other race but white alone live in only 22 municipalities, or only 13% of Connecticut's jurisdictions. And another way to think about this or to look about this, and I'm going to also kind of discuss hypersegregation as we move forward, is that means that 37.2% of all of Connecticut's BIPOC folk live in Bridgeport, Hartford, New Haven, Waterbury, and Stamford. That means they're concentrated in those 5 cities alone. The most segregated population of people who in Connecticut are people who identify as Black and African American. Out of Connecticut's 169 municipalities, 88% of Black and African American people live in just 27 of Connecticut's municipalities. And so Michelle is going to explain in the next slide how we measured segregation.
Yeah, thank you. So when we took the recently released 2020 redistricting data that I spoke about, and we applied a methodology that the Census Bureau had come up with, which they applied to states across the nation. And what they did was they created a formula that looked at, if you pick 2 people at random, what are the chances that those 2 people would be of a different race or ethnic group? And so what we have in Connecticut, our diversity index is 56%. And the nation as a whole is 61%. The highest state is 70%, which is California. Connecticut did increase, so over the last decade, in 2010, our diversity index was 46%. But as Finn pointed out, those are the overall numbers, but when you look at down to our municipality level, you can see that we have the segregation happening in the cities, with cities having the highest diversity index, and it's only in 17 towns is it higher than the national average.
And so another way to measure segregation is to use what's called a dissimilarity index. And I find that when I discuss dissimilarity indices, folks have a tendency to glaze over because it's this really hyper sort of statistical measurement, but it is what is most commonly ways to use. And the best way to think about a dissimilarity index is that the lower the value, the more integrated an area is. And so what we see statewide is that Connecticut is very segregated based on their dissimilarity index. It is higher than the national average. So we have a dissimilarity index of 64%. But again, we see increased segregation in our busier counties, right? And so 63%, 64% in Hartford and Fairfield County. And the Department of Housing and Urban Development considers any area that is above a 55% to have a very high level or high degree of segregation, and it's considered to be a high dissimilarity index. And just like the diversity indices that Michelle explained show, and similar to our dissimilarity index, Connecticut has a pattern of what I refer to as hypersegregation, where our segregation patterns almost look like donut holes around major cities. And so you'll see this map. This is just a zoom in of the greater Hartford area, and you'll see that there is significantly more people of color who live in Hartford. And as you move out of that center city, you see fewer people of color and more white people. You also, and I hope one of the things that's kind of neat about presenting on Zoom is the slides are all on your desktop. You'll also see this form of hypersegregation right down to the census tract level. So as you look at that map of Hartford, you see Hartford's West End, which has the most single family homes in the part of the city, is also where the fewest amount of people of color live within the city. So it's not just that Connecticut is highly segregated, it's that it's also in fact hyper segregated. And segregation contributes to a lot of different life outcomes, and I intentionally reduced the amount of slides I had here because there's so many other great presentations happening at this conference and that my colleagues are participating in. But one of the things that correlates closely with segregation is poor housing conditions. And we see here, these are complaints from legal services of folks complaining about their housing conditions. And we see that the housing condition complaints, meaning tenants are calling in and saying my housing is inadequate or my housing is substandard, either because of mold or bugs or mildew or mice or water or lead. They're calling from our urban centers, right? They're calling from Hartford, they're calling from New Haven, they're calling from Bridgeport. I do want to have one caveat here. This is not a complete picture of poor housing conditions in Connecticut, but this is one thing that we see directly correlated with an outcome of segregation. Highly segregated neighborhoods where BIPOC people live tend to have higher reports of poor housing conditions.
And not surprisingly, when we did a study looking at the relationship between health and housing in Hartford, poor housing conditions also are correlated with poor health outcomes. So we looked at a housing condition index, which included housing code violation reports in Hartford and vacancy rates. And then also a housing stability index was created, which looked at occupancy, rent to income, like the tenure, as well as some other indicators. And what we found is that in Hartford, someone living in unstable housing with poor housing conditions are 36% more likely to have poor physical health, 34% more likely to be a current smoker, 34% more likely to have poor mental health, and 30% more likely to suffer from COPD. So the relationship between health and housing is strong. Poor health and housing is strong.
And so I'm hoping this slide sort of ties a little bit of this all together for you, everything we've kind of spent the last 36 minutes talking about, 26 minutes talking about, because what we're suggesting here is that Connecticut is highly segregated. It is segregated as a result of discriminatory land use and housing policies. And a huge driver of that is where people can afford to live, right? And because we understand that income and wealth disparities fall so closely along racial and ethnic lines, when we don't permit a diversity of housing to be developed in a diversity of locations, we're by default going to segregate those locations. And we see this most profoundly in Connecticut played out in our zoning laws. And again, zoning is one of those things folks tend to glaze over, but the best way to kind of think about it is these are just land use laws, right? They're how we plan our communities. And they're essentially where we determine who can live where. A Brookings Institute found that Connecticut had some of the most exclusionary zoning in the country, meaning that they had zoning regulations that did not permit the development of a diversity of housing and in fact excluded a diversity of housing types over a majority of the time. We have looked at an analysis of land use records over time. The first one was reported in our 2015 analysis of impediments to fair housing and found that 25 municipalities in Connecticut did not permit any multifamily housing. Another organization has done a different zoning analysis in 2020, and their analysis produced similar findings and only found that 25 communities that didn't permit any multifamily housing, only an additional 4 communities did. And why that matters is because the least expensive way to integrate communities is to provide a diversity of housing or a diversity of affordable housing in all areas. The other thing that was found in the 2020 analysis of zoning is that 91% of the state's land is zoned for single family homes. And so this is what we would call an impediment. And with that, I will hand it over to my colleague, Erin, who's going to take over the kind of second half of this piece. And we're really interested in audience participation in this second half of the piece. So please start throwing things in the chat and I will begin to monitor that.
In addition, I am monitoring, as you can see, Michelle and I have been responding to questions in the chat. We will be continuing to update and respond to issues in the chat. I just wanted to say that Chelsea has said that a recording of this will be available on YouTube, hopefully next week at the latest. She's also collecting all of the slides that are being used in today's training and will be making those available to people who have participated in the training. So what we've done up until now is to talk about some of the things that have prevented people from living, is to talk about where people live, who lives where, and why they can or cannot move. And so the why they cannot move is called an impediment to fair housing choice. So the way in fair housing choice is defined is any action, omission, or decision taken because of someone's race, color, religion, sex, disability, familial status, or national origin, or any actions or omissions that have the effect of preventing people from living someplace based upon their membership in a protected class. So what you've heard, for instance, is in zoning issues, one of the things that the effect of zoning issues are to restrict where people can live. At the same, and what you have seen prior to the zoning explanation is exactly where people live and exactly how people came to live there over the years. And so when we were doing the analysis of impediments to fair housing, we actually identified 7 impediments. So I'm just going to read them off quickly, but I will tell you that unfortunately we will not have time to discuss all of the impediments and get your feedback on ways to overcome the impediments. So the first one, which I'm not going to talk about right this second, the decades of decisions have resulted in disinvestment in neighborhoods of color or people who are Black, Indigenous, people of color. We're going to ask for your feedback on that, so I'm going to explain that in a little bit more detail. The second impediment we found is that for a variety of reasons, affordable housing programs have not been used to promote integration adequately. We're not going to be able to discuss that today. The third issue that we found is that Connecticut is not using all available tools to combat segregation. So Connecticut has a lot of tools, some of which include some of the planning documents that municipalities are supposed to be creating and implementing are not really being used to promote integration. The fourth is about land use and zoning restrictions. We are going to talk about that and hear your feedback on how to overcome some of those impediments. The fifth is that people with disabilities have difficulty finding accessible and affordable housing. We will be talking about that. The sixth, low rates of lending result in decreasing wealth for people of color and communities of color. That's going to be discussed by our colleagues on Wednesday at a session on new lending programs. And then fair housing enforcement and education have not reached all members of the protected classes nor all housing providers. And I can see from the chat that many of you have experience with that. So we will not be discussing that. So the number one impediment that we're going to start with a discussion of is the fact that decades of decisions. So the first part of this presentation talked about the decisions that have been made on the federal level, the state level, the local level that have resulted in disinvestment in BIPOC communities, whether it is refusing to invest in infrastructure in BIPOC communities or making investments only in BIPOC communities that serve people who live outside those communities. So their policies, the federal, state, and local policies have, as we already saw, locked BIPOC households into only a few neighborhoods and then have disinvested in those neighborhoods. So anybody who's been in inner city Bridgeport or the South End or the North End of Hartford or some places in New Haven have really seen that disinvestment, not just in the housing, but in all of the infrastructure there. So our question to all of you, and I hope that you will share comments and questions in the chat, is how do we invest in BIPOC communities to improve them for the residents who live there? Too often what we see is investment where high-priced housing and all of the amenities that go with that are not available to people who are currently living in those communities. And in fact, the gentrification that happens as a result of that ends up in pushing people who currently live there out. So we're asking you to either unmute yourself or share in the chat. What can we do? What are your suggestions for how we can improve communities without pushing out people who have spent their lives trying to improve those communities?
Erin, one of our first comments was from Antonia Edwards, and she suggested collaborating with community organizations as sort of a solution to this impediment. Perhaps we could discuss some of the recent success regarding community organizing and how that has advanced the goals of the Civil Rights Act or Civil Rights laws.
I'd be happy to do that. Larice Harvey, did you want to say something? I see that you have unmuted yourself. And as opposed to listening to me talk, I'd love to hear you.
Hi, thank you so much for letting me speak. So working in the field and working with homelessness in Connecticut and Connecticut Coalition for Homelessness, and more so working with people with criminal records, we still find that a lot of even HUD staff, people who work in housing authority, are not abiding by the 2011 HUD letter that says you cannot discriminate against people with criminal records. It's got to be on a case-by-case basis. And what we're finding is that this population is still suffering. So I have never been homeless because I've been evicted. I've been homeless because I live with people who couldn't put me on the lease, and then they moved, and then I have a hard time finding housing. It takes at least 6 months to a year to get anybody to consider me, even though my crime is over 20 years old. And I'm not the only one. And they don't consider, they never ask the question, how did you become homeless? And to me, another homeless demographic, or whatever you call it, should be anyone with a felony conviction that is not on a lease should be considered homeless. Because the minute that person gets mad, or the landlord knows that that person is there and wants to evict that family, they do so and have done so, and we have no protection, none whatsoever. So I think one thing you could do is use some of that emergency COVID money for emergency Section 8 housing. Over 25%, that's over 800,000 people in Connecticut have a criminal record. And when we look at last year's data about who was homeless in Connecticut, they said 2,000 people. I'm sorry, based on the current data of analysis of who is homeless, that is inaccurate, especially for people with criminal records. So we need to change who is considered homeless, especially when it comes to cases of domestic violence and criminal records.
Thank you. That is excellent, excellent advice. And I don't mean to cut you off, but I'm interested in hearing what Antonia Edwards has to say. And I'm hoping more people will chime in both in person and in the chat. So Antonia, I'm going to send it over to you. Thank you, Larissa.
Hi, everybody. I have a grassroots organization called Solidarity, and I legislate for racism as a public health crisis. I work really closely with Senator Amwa to get that bill passed, and also include the study of the historical context of being a Black American descendant of slavery and how perpetually over the years we've ended up in this situation. I'm from Boston. However, Boston is very racist. But coming to Connecticut, it's very segregated racist. There's a huge difference. And so in the findings, Connecticut has 8 counties, and out of the 8 counties, Black and brown people populate majority 3 of those counties. And it was done through redlining first, and then it was done through zoning. And so as the information stated, it was done on purpose to prevent Black people from living in suburban areas. I also worked very hard with DSEG Connecticut. I thought it was very important to dismantle those laws, and we did a great job doing that. And I take my hats off to DSEG Connecticut. They were very instrumental in getting rid of those zoning laws, and now multiple dwelling housing can be built in those communities. What I'm disappointed about is that with all the disparities that happened prior to COVID, COVID just unveiled them. And everybody sees how disastrous it is. And I'm really saddened at the fact that all the money that's come through, whether it be the CARES Act, the American Rescue Funds, did not go to help people in the underserved community. And so I didn't want to see building high rises. I didn't want to see building luxury apartments, even in New Britain. I've lived there as well too. People, the rents are $2,700. And I just feel like people need to speak up and step up and complain, legislate, protest, email, call. It's a very much slap in the face that all of us went through the serious pandemic last year. Some of us have lost of life, loss of medical situation. Some of us what we permanently medically affected by it. But then loss of income. Lost, just displaced mentally. I mean, as to what happened. And so these people don't know where they're going to live. And then with the moratorium being lifted and funds not being released from UNICT in time, they're fighting with their landlord. So there's a group of people currently who deserve the immediate attention. And those are people who are working their butts off, lost their jobs. Now they can't get unemployment. Now because they won't get vaccinated because of a personal choice. There's so many barriers that are creating people in these other communities, but primarily in the underserved communities from being functioning. So all this money from the COVID relief should have been applied to COVID relief issues that were already here, but again, exasperated itself with it. And it should have been for housing. That should have been our primary goal, was to do housing stock. I work with Arunan with the Hartford Land Bank Trust, and he has property in Hartford that he wants to get developers to build and then sell to the community for affordable housing. I think that there needs to be a huge education program to teach people. Everybody thinks affordable housing is for everybody. It's not. Low income housing is what people need in these communities. Affordable housing has a minimum income. It could be $68,000, it could be $100,000. These people in these communities are barely making $20,000 to $30,000. So why build luxury?
Antonia, I completely agree with you. I think you've made some excellent points, particularly with regards to affordable housing is not necessarily affordable for everyone, especially people who are low income. I think that goes along with what Larissa was talking about with regards to people who have a criminal record, or what she put in the chat about people who cannot raise their credit scores because they are so low income. And I wish we had time to talk about some of the ideas that people put in the chat, particularly around home ownership. But I want to move on to the second impediment to talk about, because we only have about 20 minutes left. And that does come back to land use and zoning restrictions, which Antonia was just talking about. They limit or impose illegal land use policies that prevent the creation, development, or rehabilitation of housing for people protected from discrimination. See where we didn't put in affordable there, Antonia, because we recognize affordable doesn't really get to everyone. It has been said during her piece of the training, it continues to be a major impediment with local zoning boards of appeals. That's what ZBA stands for, preventing affordable housing. So the question that we have for you is, what can the state do to address the zoning and land use policies that are barriers to integration? So for instance, one of the things I've seen mentioned a couple of times in the chat is that New Haven is doing inclusionary zoning. That's a local decision. That's not something that the state can say, okay, City of New Haven, that's a great idea, or that's a bad idea. What can the state do to change zoning policies and practices to overcome barriers to integration? Since we do not allow the state of Connecticut to go into communities and tell them how to organize their land use and zoning policies. So what can the state do?
Erin, while we're allowing the audience to think about that, can you click back to just the impediments so folks are able to read what we're determining? Yeah, thank you. There was a request in the chat for that.
So somebody just put in the chat, broaden the advocate base. If we link zoning to economic development as well as smart growth policies, we can attract other advocacy groups that will help encourage zoning reform. And I agree that that is an excellent idea, but that's not something that the state can do, right? The state only has statewide powers. It can't require. that a local community listen to the advocates. Somebody put in the chat inclusionary zoning mandate through Zoning Enabling Act. That's been suggested several times. And for those of you who followed the zoning debates last year, that was really difficult. But I wonder if putting the two issues together, inclusionary zoning and expanding the advocacy base, would help. There's currently a movement called Fair Share Housing that would address some of this. And Finn, do you want to talk about that, since people are probably tired of listening to me?
Sure, I'm happy to. So there is a movement within the state of Connecticut, and we're calling it fair share zoning. And what this does is this actually really gets to that affirmatively furthering fair housing requirement by, instead of just having sort of a 10% blanket across requirement of the amount of affordable housing a city or a municipality is supposed to have, Fair Share uses sort of a data-driven metric solution to determine which municipalities need how much affordable housing. And I think, like some of our comments before, Fair Share also gets at what we heard from other folks, not just affordable housing blanket, but deeply subsidized affordable housing for individuals who are not just below median income level, but extremely below median income level. And Fair Share requires a data-driven solution to provide housing for folks who live in Connecticut right now, right? And requires municipalities to step up to the plate and make an affordable housing plan that would meet those needs. Erin, there's several other suggestions in the chat, including a look at the Massachusetts policies that our office has followed closely. Oh, and Kaylee shared a fair share zoning session at noon on Wednesday. And I did want to promote, there was some earlier discussion about affordable home ownership in Connecticut. Our colleagues at the Fair Housing Center are also presenting on Wednesday afternoon about different pathways to home ownership.
Thank you for all of your suggestions, especially those in the chat. One of the things that Finn and I are doing is making notes of what you're all talking about, because we want to include some of that as we finish up the analysis of impediments, especially some of the other issues that people have raised about inclusionary zoning, density bonuses. I really like the comment that somebody put in, which is change the taxation policy, because that's what drives zoning decisions. I always say that real estate is about money. You know, people are not in it to be altruistic. They're not there to be nice to people. They're there to make money. And if we make it hard for them to make money doing the wrong thing, but easier for them to make money doing the right thing, then that is a better policy. We're really coming down to the end of our time. And one of the things that we have noted throughout our work on the analysis of impediments is that people with disabilities are really left behind when we're discussing accessible, affordable housing or subsidized housing. There isn't enough focus on the needs of people who are disabled. And there will continue to be a need for deeply affordable housing for people with disabilities. And one of the things that I want to point out is we showed you earlier that Connecticut is an aging state. And what we're seeing is that if someone is elderly and disabled, that usually means that they're white. And most towns are happy to build elderly affordable housing. Because they know that that housing is going to be mostly for people who are white. We're talking about funding for housing that is accessible to people with mobility disabilities, as well as people with mental disabilities, as well as people who are young and disabled who do not happen to be white. And there really has been no systematic effort to identify housing that meets the accessibility requirements that went into effect in 1991, for goodness sakes. We still have not really implemented that. So our question to you, our last question is, what can Connecticut do to ensure that people with disabilities have access to accessible, meaning physically accessible, affordable, and deeply affordable housing? So if you could give us your insights on that, I'd really appreciate it.
While we're waiting for audience members to collect their thoughts, I did want to share that discrimination against individuals with disabilities is the highest form of discrimination, or the highest level of discrimination that we see at the Fair Housing Center. And I see
hold on, Tonya, I see you have your hand up. Go ahead.
Hi. I also work in the field of disability. My son is autistic. I sit on several governor-appointed boards, Connecticut Council for Development Disabilities. I moved here 4 years ago, and I fought very hard to make my son independent. I didn't want him to be 30 years old, sitting on my couch, not effective. I actually petitioned and fought for him through DDS and also through the government for him to live in a CSL, which is a community supported living environment. He lives better than I do. He has a tennis court, movie theater, swimming pool, whatever. And we have to get into that. We have to buy into these apartment complexes, have them block them off, offer them the RAP certificate to allow these people who aren't otherwise able to make livable wages. I mean, some of these people make sub-minimum wages and be able to cushion them so they have a right to live, and also seniors. So I myself personally did it for my son. He has a fabulous life. He's 22 years old. He's been there since last year in March. And so that's what we need to do. But if you're going to build affordable housing, build some of them for the disabled, and then use the RAP certificates to cushion them, and then have these organizations that were group homes, basically expand themselves to monitor and maintain them. I mean, so that they can live, independently. He has the Alexa system. It's all smart house. The Alexa system tells him whatever he needs to do for those who aren't as independent as he is. And it very, very much works. And so that's what we need to do. We have to invest in our seniors and our people that are disabled in our communities.
So, Antonia, I think that one of the things that you're bringing up, which I tend to think about, as you can see from my gray hair, I'm not as young as most of you. And I worry about my friends and family members who have disabled children living with them as they get older. And how are they going to provide for their children in the long run? And for those of you who have been following the Connecticut Fair Housing Center, which I'm sure you all, look for our tweets and Facebook updates every single day. We just won a $5 million verdict against the town of Cromwell because of the way that they treated a group home for men with disabilities. And the amount of opposition by the town, the amount of opposition by neighbors was appalling. And so I agree with Antonia that we need to do more of that. But again, I think it does come back to some zoning reform, and not just on the edges where, maybe some towns in some instances at some point in the future will someday allow a couple of ADUs, accessory dwelling units, but real deep changes to the way that we do business in the real estate market. And I agree that some of it is we have to address the stigma and the fear that are part of this. And unfortunately, I don't know, unfortunately, I guess, unfortunately, I'm a lawyer. I don't look to change hearts and minds. I just look to change behavior because that's all the law can do. I have to look to everyone else like Antonia and Larissa and other people who have been commenting in the chat to do the changing of the hearts and minds. Thank you, everyone. We're just about to finish, but I have been talking for most of the last few minutes, and I want to give Michelle first and then Finn a chance to wrap up. Please continue to put your comments in the chat because we are taking note of them and taking them down. So go ahead, Melissa, and I'm sorry, Michelle and Finn.
Thanks, Erin. Yeah, this has been a great session. Thank you all for your ideas. The 2020 data will be coming out next year, and we'll be doing a lot of analysis around it. And looking at, housing changes, population, racial and ethnic changes, demographic changes. So stay tuned, for more information. You can go to ctdata.org, our census hub, to see updates there. So thank you for this opportunity.
Again, I actually just want to take a moment to thank C2 Data and Michelle and her team. When the census released redistricting data earlier than they said they would, and I had to redo our analysis, Michelle's team saved the day very quickly. So we're just so grateful for our partnership with them. And I want to thank the partnership again for hosting this conference, and a final encouragement to attend some of the other sessions that you see. We really just hit the very tip of the iceberg today, and the state of Connecticut and how deeply segregated we are impacts and touches pretty much every aspect of our lives. And I know that additional sessions will do deeper dives into the things we were unable to connect to today.
And I just want to thank everyone for their comments. We are ending just about 5 minutes early, and I hope I didn't cut off anyone who wanted to speak, as opposed to just put things in the chat. But we are interested in continuing to hear from you. My email address, if you want to comment directly to me, Finn will put it in the chat. It's erin@ctfairhousing.org. And we will be publishing the Department of Housing will be publishing the analysis of impediments to fair housing, so that you can continue to follow this discussion and see more of the data. And I cannot urge you more to go on to Michelle's site, ctdata.org, because it is a place where they are doing a lot of this work. So thank you all very much. We got you out of here 4 minutes early, so you can get to the next session at 12:30. Good luck, and I hope to see you in some of the other workshops. Bye-bye.